Today we'll discuss on the national nutritional programs. There are various nutritional programs. National means under our country, in our country India, okay? There are various nutritional programs which are sponsored by the government of India. So let us first see in the introduction. Government of India has initiated several large-scale supplementary feeding programs. So why these nutritional programs are done? These are done to increase the nutritional status, to decrease the malnutrition or the malnourished children in various parts of India. So it will also help in overcoming the deficiency disease through the various ministers to coordinate the malnutrition. Okay, to overcome the malnutrition, see, these nutritional programs are launched. Let us first see what is the definition of nutrition. Nutrition is a science of food and its relationship to health. So it is primarily concerned with the part played by the nutrients in our body growth and development and maintenance. So in short, nutrition means the role that our nutrients, various nutrients like vitamins, minerals, various electrolytes and all which are nutrients which are required in our body. The role which is played by this nutrition in our body, like growth and development and maintenance of our body functions. The study of this food and its relationship to health is known as the nutrition. The various nutritional programs in India under the Ministry of Rural Development, we have the Applied Nutrition Program. Under the Ministry of Social Welfare, we have the Integrated Child Development Services Scheme, that is the ICDS scheme. Then the Balwari Nutrition Program and Special Nutrition Program. Under the Ministry of Health and Family Welfare, we have the National Nutritional Anemia Prophylaxis Program, that is to eliminate the anemia in the child. Then National Prophylaxis Program for prevention of blindness due to vitamin A deficiency. So there are we do not see this vitamin A deficiency. Blindness is caused due to the deficiency of vitamin A. This is not commonly seen in our society nowadays, but in the various remote areas of India, in the various remote areas, in the slum areas where there is no provision of immunization and all, these are still available, these are still seen. So to eliminate those deficiency of vitamin A, this National Prophylaxis Program for the prevention of blindness is launched. The National Iodine Deficiency Disorder Control Program. So iodine deficiency, we have known that the goiter, which is a disease which is caused by the deficiency of iodine in our body. So to defeat or to combat this iodine deficiency disorders, the National Iodine Deficiency Control Program is launched. And Ministry of Education launched the midday meal program. Everyone must have heard of the midday meal program. That means this meals are provided in the schools, government schools and Anganwadi centers to the children. This is known as the midday meal program. So let us see one by the first one is the ICDS scheme, that is the Integrated Child Development Services. This is under the Ministry of Social Welfare. So this ICDS scheme was prepared it was launched in 1975. Then the population norms for setting up of Anganwadi centers and mini Anganwadi centers has been revised to cover all habitations by SC, ST minorities. Okay, so this ICDS scheme or ICDS service are provided in the various Anganwadi centers. Rural and urban project population range from 400 to 800. So that means it will cover around 400 to 800 Anganwadi centers, each in the rural area. Now let us see what are the services provided by the ICDS. ICDS will provide the supplementary nutrition. That means it will give the various nutritions which are required, but the various type of foods or diet which are required by the children, school going children. So this supplementary nutrition will be given. Then next is the immunization. Immunization, we have all known what is immunization. It is the immunization is done to prevent the various disease in the child. These are given stage by stage. Okay, the various example of the immunization are the oral polio vaccine, then the pentavalent, Japanese encephalitis, measles, and all. In order, the most important is the BCG, which is given to prevent the TB, which is given at birth, and hepatitis B vaccine. This all are to be given immunization under the immunization. Then health checkup. The routine health checkup of the children should be done. So this ICDS will provide the health checkup of the various children. Then medical referral services. So in the rural areas, in the remote areas where there is no facility, where there is no modern facilities and no modern machines available in the sub-center or the primary health centers. So in this case, the ICDS will provide the referral services to the higher authority, to the higher level of treatments for the benefits of the child. Then nutrition and health education for women. For women, that means for the mainly for the mothers. Okay, here for the mothers, they will provide the nutrition and health education. Then non-formal education for children up to 6 years. Then the objectives of ICDS. By doing the various services which are considered under the ICDS, like the immunization, health checkup, then education, nutrition, health education, supplementary nutrition, all this will help in improving the nutritional status of the children. So they will help in overall nutritional health status of the improving the health status of the children, which is under 0 to 6 years. Then they will lay the foundation for proper psychological, physical, and social development of children. Not only the physical development is necessary for children, they are growth and development is taking place in the child. So we have to monitor carefully not only the physical development but also the psychological and social development of children. This ICDS will help to lay the foundation for the proper psychological, physical, and social development. To reduce the mortality and morbidity, malnutrition, dropout. So that means mortality means the death rate. Morbidity means the disease causing rate. So malnutrition, dropout will also be prevented, reduced, and the mortality and morbidity rate will be reduced. Next, to achieve an effective coordination of policy and implementation among various departments. So various departments like mental health departments, community department, then medicine department. So these various departments they will link together and work in the development of the health and nutrition of the children. To enhance the capacity of mother and nutritional oral needs of children through proper nutrition and health education. That means to provide the nutritional needs of the children through health education. Also, health education means we will advise or we will educate the mothers or the caregivers about the various benefit of nutrition, eating the proper nutritious diet. Okay. Then under the supplementary nutrition, the aim of this supplementary nutrition scheme is to supplement nutritional intake. There are various parameters which are given for each child 6 months to 6 years. 50 kilocalorie, 12 to 15 gram of protein should be given. Then the financial norm of ₹4 per child per day. That means if it is 4 per day, that means in a month how many will be? 4 into 3, ₹120 per month. Then several malnutrition child 6 months, from 6 months to 6 years. In the malnourished child or in the malnourished children to from 6 months to 6 years, 800 kilocalorie and 20 to 25 grams proteins will be given, and financial norm of rupees 6 per child per day will be given under the supplementary nutrition. So here they will also get the nutrients, the various nutrients like proteins, and they will also get the financial norms. Then not only for child, the pregnant woman and nursing woman will also get 600 kilocalorie, 18 to 20 grams of protein, and financial norm of rupees 5 per day under the supplementary nutrition scheme. So here in the picture also we can see who are the beneficiaries: children, severely malnourished children, pregnant and lactating women, how much calorie, how much protein they will be getting, and how much financial assistance they will be getting. This supplementary nutrition is given for 300 days in a year. Finance is provided by the state. Then weight of the children is checked every month. So these are the various norms under which a supplementary nutrition is given. Then nutritional health education is given to mother and children suffering from first degree malnutrition. Supplementary nutrition is given to second and third degree malnutrition. 4th degree malnutrition are advised for. Next is a nutrition and health education. Nutrition and health education is given to all women in the age group of 15 to 45 years. Then priority is given to the nursing expectant mother. So the knowledge will be provided to the all the women between the age year of 15 to 45, and priority is given to the nursing expectant mother. They are advised to get the various nutritious food and how they can apply for the scheme, and how they will by eating what type of foods they will be getting the more nutrients. We have to advise them. Immunization against 6 preventable vaccines. These are also known as the 6 killer disease. This immunization will protect the child against the 6 killer disease. That is the diphtheria, pertussis, tuberculosis, measles, tetanus, polio. So they will be provided the immunizations, and mother are immunized against the tetanus. So we all know that pregnant mothers should be immunized with the tetanus. Then health checkup includes the antenatal care during the pregnancy, then postnatal care after the delivery of the baby and the care of the newborn, then care of the children under 6 years of age. Minimum 3 physical examinations are done. So we have to do the regular routine examination of the newborn, or the 3 physical examinations after the child is born. Then high risk mothers refer to appropriate institution for the special care. That means the high risk mothers, like mothers who are suffering from the any bleeding or any type of disorders like the eclampsia. Then diabetic mothers who are suffering from the diabetes, and all these are the high risk mothers, and they will be provided the special care for the according to the appropriate institution they will be referred. Then health care of children under 6 years. Children under the 6 year of age, what they will do, they will provide the recording of weight and height of children at periodic intervals. Then we have to watch over the milestones, the various milestones of various children. Then immunization, they will look after the immunization if the child is immunized at the specific given period or not. Then general checkup for every 3 to 6 months to detect disease and malnutrition. Then treatment of disease like diarrhea, RTI, respiratory tract infections. Then deworming, this will be done. Then prophylaxis against vitamin A deficiency, anemia. So the vitamin A deficiency prophylaxis, vitamin A is given. Then referred of serious cases to the hospital. If any serious condition is there, we have to refer those cases to the hospitals. Then a card containing health record of child is given to the mother. So health record card is given to every mother. Then next is a non-formal preschool education. Preschool means before the child is going to the school. Children of 3 to 5 years are imparted non-formal preschool education in Anganwadi centers in each village about 1,000 population. So these children are teach in the Anganwadi centers before they are exposed to the actual school. These are done to provide the opportunity to develop the desirable attitude, values, behavior pattern among the children. So when they are exposed to the Anganwadi centers, before they are exposed to the children, then they will try to develop certain desirable attitude, social norms, and they will help in the socialization in the children. Next is the midday meal program. Midday meal program was launched in 15 August 1995 and it is revised in 2004. It is also known as a National Support to Primary Education. So let us see what are the aims. The aims of the midday meal program is to fulfill 1/3 nutritional requirement of school children. So we have the various children in the school which do not meet the daily nutritional requirement. So to fulfill the nutritional requirement at least 1/3, we have launched the midday meal program to create the interest about school and education. So when the meal is given every day to the school, the children will be more interested in going to school. Then to reduce absenteeism in school. So when they have interest in going to school, there will be less absenteeism. They will go to school regularly. To provide relief to parents of poor children. So the parents who are earning for the daily bread or which are earning on a daily basis from daily wages, they will not be able to provide the sufficient nutrition to their children. So it will be helpful for those parents who are not able to provide the sufficient diet of those children. They will get the nutrition from the school. From the principles are 1/3 energy and half of protein requirement of the child must be met. So we have already discussed in the aims. That means 1/3 of the nutritional supplements should be given. Then food should be free and at minimum cost. Food should be prepared in school itself. Locally available food should be used in preparing the meal. Menus should be changed to avoid boredom among the children. So here what are the principles of the midday meal program? We will provide the various nutritional supplements like proteins and energy giving foods, and it should be given free, or then it should be prepared in the school and local items should be used while preparing the food, and the menu should be changed accordingly. The children might get bored of eating the same meal daily. So under the midday meal scheme, at least 300 calorie and 12 gram protein is provided to all the primary class students. Next is the vitamin A prophylaxis. So I've already told in the beginning, this vitamin A is given to control the deficiency of vitamin A. That means to prevent the blindness. It is one of the components of the National Program of Control for Blindness. So there is a separate program, National Program for Control of Blindness. It is vitamin A prophylaxis is one of the component of it. It was launched by the Ministry of Health and Family Welfare in 1970. Here, they will administer a single massive dose of oily preparation of vitamin A containing 2 lakh international unit orally. So this is a capsule. It comes in a form of capsule, and we'll cut it and we'll give the gelatinous or the sticky liquid to the children, to the child. Deficiency of vitamin A will cause the night blindness, conjunctival xerosis, Bitot spot, and xerophthalmia. So these are the diseases which are caused due to deficiency of vitamin A. So here I've also told you that it should be given for every 6 months. So first, In children between 6 to 11 months, in the infants between 6 to 11 months of age, 1 lakh international unit of 1 dose of vitamin A solution should be given. And after 6 months, again 2 lakh international units should be given to children of 1 to 5 years of age. So the first dose is given at between 6 to 11 months. That is the 1 lakh international unit. Then second dose is given at 1 to 5 years, beginning from 1 years up to the 5 years of age. It in an interval of 6 months, every 6 months 2 lakh international unit of vitamin A solution should be given. So from 1 to 5 years, every 6 months, that means the child will receive total of 9 doses of vitamin A solution until he attains the 5 years of age. Next is the National Nutritional Anemia Prophylaxis Program. This is to combat the disease called the anemia. This program was launched in 1970 by the Ministry of Health and Family Welfare. This is done to prevent the nutritional anemia in mothers and children. Beneficiaries are under this scheme. Children of 1 to 5 years of age will be getting. Then expecting and lactating mothers, family planning, that means the IUD acceptors, intrauterine device acceptors, they will be getting. And then policy, expecting and lactating mother as well as IUD acceptors will receive 60 mg of elemental iron plus 0.5 mg folate every day for 100 days. So under this policy it is given like this, but nowadays I think it is changed. It is changed, like we have to give the iron in the expectant mother or the pregnant mothers 6 months for 6 months. Then after the pregnancy also, in the postnatal mother also, we have to give for another 6 months. And children of 1 to 5 years will be given 20 mg of elemental iron plus 0.1 mg folate every day for 100 days. Next is the National Iodine Deficiency Disorder Control Program. This is done to prevent the goiter. It was launched in 1962 by the Ministry of Health and Family Welfare. Its main focus is use of iodized salt, replacing of common salt with the iodized salt. It is the cheapest method to control the iodine deficiency. The objectives are to assess the magnitude of the iodine deficiency disorder, then supplying of iodized salt, reservice 5 yearly assess to assess the impact of iodized salt and iodine deficiency disorder, lab monitoring of iodized salt. Then health education. Next is the Balwari Nutrition Program. It was started in 1970 under the Department of Social Welfare through the voluntary organization. Its main objective is to give the proteins and energy giving foods for 370 days in a year in the preschool. It will also provide the preschool education also. That means the education in the Anganwadi centers. Then beneficiary group are children of children of between 3 to 5 years of age. Nowadays, Balwaris are phased out because of the universalization of ICDS. So under the ICDS, we have learned various services like giving of supplementary nutrition, immunization, health checkup, medical referral service, nutrition and health education, non-formal education. So all these are provided by the ICDS. If the ICDS are performing their functions well, in a very well manner, then if there is no lack of the services provided by the ICDS, then I think there is no need of the Balwari nutrition program. So it is being phased out because of the use of the ICDS scheme properly. Then special nutrition program. These are beneficial to the children below 6 years. And also for pregnant and lactating women. The services provided are giving the nutritional supplement to the preschool children, 300 kilocalorie and 10 to 12 gram of protein. Then for pregnant and lactating mother, 500 kilocalorie and 25 gram proteins. So in a year, 300 days, they will provide the service. Then nutrition program for adolescent girls. Adolescent girls are being neglected everywhere, but we have to put the main focus on the adolescent girls because they are the ones who need to get the most nutritional requirement. So the aims are to improve the nutritional and health status of the adolescent girls, then provide nutrition and health education to the beneficiaries and empower adolescent girls through increased awareness to take better care of their personal health and nutritional needs. Beneficiaries are adolescent girls below 35 kg and pregnant women below 45 kg. Services provided are 6 kg. They will be implemented through the Anganwadi centers and weighing of 4 times in a year on the basis of the body weight. Issuance of the live rice will continue for 3 months. So this is the nutritional program for the adolescent girls. So during this adolescent girls, they will be having the menarche. So to watch over their menarche, and during the time they should get a proper nutritional supply. Then immunization. They should be checked if there is any left out immunization, and it should be given. Then they should be done general health checkup for every 6 months. Minor ailments should not be left untreated. They should be trained for the minor ailments. Then deworming. If there is a condition, this condition, then they should be treated by giving the medications. Then prophylactic measures like against anemia, goiter, vitamin deficiency. If they are at risk of getting the anemia, goiter or vitamin deficiency, and they should be given the prophylactic measures, then they should be referred to the PHC in case of the acute needs. Then girls are also provided supplementary nutrition and at 2.5 per girl per day. So these are all about the nutrition program for the adolescent girls. Under the national nutrition programs, we have learned about the various nutritional programs under the Ministry of India. They are the ICDS. We have learned about the ICDS. Then Balwari nutrition program, special nutrition program, iodine deficiency, disorder control program, then vitamin A deficiency control program, nutritional anemia control program, midday meal program. So these are all the important programs under the nutritional programs under the Government of India.